We know that unfortunately almost every patient with multiple myeloma will have a relapse, meaning their disease will come back after it's initially treated. But thankfully, we're developing better and better therapies for our patients at that earlier first relapse, typically as we define it as 1 to 3 prior lines of therapy. The area of particular interest at ASH this year was the drug belantamab mafodotin. This was a drug that was removed from the market a few years ago because of a negative clinical trial, but now we're seeing updates from 2 very important trials called the DREAM7 and the DREAM8 trial, which interestingly were studies that compared 3 drugs versus 3 drugs. Often we have clinical trials that compare more versus less, but here it was 3 versus 3 using belantamab with pomalidomide and dexamethasone or belantamab with bortezomib and dexamethasone. And in both trials, we saw considerable benefit of adding belantamab, not only in progression-free survival, but even in overall survival. And we think this is going to herald the reuse of this drug back in the clinic. It is going to be reviewed by the FDA, and we anticipate potentially hearing in the middle of 2025 if we can bring this drug back into the clinic. And I think it's particularly important because in a complicated disease like myeloma that have patients of various backgrounds, of different ages, in different geographical settings, we want options for our patients. And belantamab provides an option that is a little bit easier to administer.